My name's Barbara Birsinger, and I have a nutrition background. I have a master's in public health nutrition from UC Berkeley. I also have a more recent doctorate in spiritual healing and energy medicine. And I'm a licensed practitioner of heart math, which is an emotional regulation technique, stress reduction. And I'm a master neurolinguistic programming practitioner. So I use all those modalities in my work with people. So I do a lot more than nutrition and nutrition planning. Mostly I work with people on their behaviors, with people on a lot of different levels to help them to be able to eat better, but it comes from within them. So I teach intuitive eating, conscious eating or mindfulness with eating. It has to do with really listening to the body. So when someone wants to eat something, no matter what it is, we take the judgment off of the food. Exactly, like it's no such thing as a good food or a bad food, but rather how is that going to feel and react in my body. We're here today talking about diabetes education, and someone's body knows what their blood sugar is. Everybody's body is functioning, and there's all kinds of things going on in our body. So I teach people how to get a little better in touch with what's happening inside their body. So when they want to eat something, they will be able to imagine that food in their body, how it feels going through all the systems in their body into the energy system, and how they're going to feel over the next 2 or 3 hours while that food is in their body. And that's what really guides their decisions on what, when, and how much to eat, along with some education, which is important, but mostly it's learning how is this going to feel in my body, how is this going to affect the systems in my body. Movement, learning how to enjoy and find joyful movement in their life, because that's a huge piece for people who have diabetes, is being able to regulate their insulin through exercise. And it's probably one of the major pieces of the program is learning how to move the body and be able to take that home with them. I think all the things that we're teaching here are things that people can sustain when they get home. And through our clinic, the integrative medical clinic, they'll be getting continued care once they go home, whether it's on site at our clinic, or it could possibly be via telephone or webinars. And I also work with people around what we call health at every size. So rather than someone coming and thinking, if I only lost weight, I wouldn't have diabetes. And that's definitely not always the case. People can become fit, manage their stress, eat really well in terms of foods that are good for their body, are good for their diabetes, and manage their blood sugar, lower their cholesterol, lower their blood pressure, and increase their fitness and increase their muscle mass, and their weight on the scale might not change that much, but they're definitely improving their risks by lowering all those metabolic symptoms.